Good afternoon. Thank you for being here. My name is Nick Abu Asli. I'm the mayor of the city of Marion. Today's press conference is intended to be different from the press conferences that we've had over the past couple weeks. This press conference is for the purpose of hearing from our county public health department and the medical community. We want them to tell us where we are currently in this crisis, what we've been able to accomplish so far, where we're headed, and what they recommend we all do going forward. Well, you won't be hearing much from regional decision makers today, and we encourage everyone to simply go to your city websites and get all the updates. But we want you to know that we're all working tirelessly and coordinating constantly with each other on our response, and we are united in our goals and efforts to see our region and state through this crisis. So on all our behalf, and with one voice today, we urge you to listen to the information presented and heed the advice of our healthcare experts. This is a community-wide issue, and the effort needs to be community-wide to combat it. We won't be successful unless we all understand the seriousness of the situation, accept the responsibility we have to each other, and all do our part. So with that, I will introduce Heather Medder with the Linn County Public Health.
Thank you. Good afternoon. Again, my name is Heather Medder, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As many of you know, the number of COVID-19 cases that have been confirmed throughout Iowa has increased daily. We are now up to 179 cases in Iowa and 12 cases in Linn County. COVID-19 is spreading in Linn County and in Iowa. We all must do everything we can to slow the spread of this virus. According to an article recently published in The Lancet, practicing social distancing can reduce transmission of the COVID-19 virus by 60%. If we do not slow down the spread of this virus, we run the risk of overwhelming our healthcare system. Through our investigations, we have learned that some individuals with COVID-19 have very mild illness. Some individuals have not had a fever, and others have not had a cough. We have individuals that have stated to us that their illness was so mild that in the past they would not have stayed home. For this reason, I want to strongly emphasize that everyone must practice social distancing. COVID-19 is in our community. At this time, you must suspect that every individual that you come into contact with has this virus. We are aware that youth and young adults are extremely social and value the connections that they have with their peers. However, this is an unprecedented time. We need parents and the youth to follow social distancing and not visit in person with their friends. We urge individuals to use social media platforms and video chats. This may be difficult for many youth, but it is of utmost importance to decrease the spread of COVID-19 within our community. Vulnerable populations, such as an older adult and those with underlying medical conditions, are at a higher risk for serious illness from COVID-19. There are the people that we are protecting by practicing social distancing. If you do not follow our recommendations, you are putting people's loved ones at risk for serious illness or death. Businesses have an important role to play in slowing the spread of this disease. Businesses should close all public spaces, such as lobbies, cafeterias, conference rooms, and any location where people may be mixing together. We strongly encourage you to have your employees work from home and not work in the office, if at all possible. Also, consider redoing the way you perform your normal operations. Reduce the number of employees in your workspace at one time. This may include split shifts, flexible scheduling, and working remotely. I also want to emphasize that individuals at work should be sent home if they show any signs of illness. It does not matter how mild that illness may be. People should go home even if their illness is something that they would not have gone home for before. Anyone that is sent home should follow the guidelines for ill Iowans, which can be found on the Iowa Department of Public Health website. These guidelines are as follows. If you are ill, stay home. Isolate yourself from others and others in the home until you've had no fever for at least 72 hours. That is a full 3 days of no fever without the use of medicine that reduces fevers. And other symptoms have improved. For example, when you cough or if you have shortness of breath, that those symptoms have improved. And at least 7 days have passed since your symptoms first appeared. If you think you need health care, call before you go in. And I want to emphasize all 3 of those need to be met before you return to activities. We are asking everyone to take these measures now in order to protect our vulnerable populations and to prevent overwhelming our healthcare system. Our healthcare providers have limited personal protective equipment and need to conserve resources for those that are most ill. We are aware that some local businesses have been announcing that they have employees that have been diagnosed with COVID-19. Cases of COVID-19 are reported to the local health department where the individual lives. Local public health officials where the employee lives will follow up with the potential exposure, including the workplace. Local public health agencies work closely with the employers to properly notify those that have been potentially exposed and to provide instructions for those employees. If a person resides in a county different from where they work, local public health agencies will work together as appropriate for follow-up. Finally, I want to address a few questions that we have received regarding how to clean your home. As part of your everyday prevention actions, clean and disinfect frequently touched surfaces and objects. This includes tables, countertops, light switches, doorknobs, and cabinet handles. Recommended disinfectants include diluted household bleach solutions, alcohol solutions with at least 70% alcohol, and traditional household cleaners and disinfectants. Follow the instructions on the label. In closing, we are asking our community to take every means necessary to slow the spread of this virus. Please take these actions now if you have not already. Thank you.
Hello, thank you. Dr. Tony Myers from Mercy Medical Center. Heather does such a great job of describing what we need to do. I talked about this some on Monday, the importance of doing everything that she just said, essentially. And what we found over the last few days, and I know And again, I want to thank all the community for their efforts. Some of these are unnatural for us, and I understand that. But if you look, when I talked on Monday, I talked about the rate of increase in cases, how quickly the cases are doubling, essentially. We only have a short period of time since Monday to now, but the short facts of the case are that we are doubling too quickly in our first few days. The rate that we're doubling will overwhelm the hospitals in the next 2 to 3 weeks. We have to do better. We have to keep the 6 feet between us. We have to not go out unless it's absolutely necessary. We have to do all of the things that Heather was talking about with washing our hands. We know, unfortunately, there will be deaths due to this virus, and that is inevitable. But in order for us to prevent and save as many as we can, the hospitals have to have them come in slowly or slower, even with our increased capacity, so that we can take care of the critically ill people. We have to do better. A couple of things in our efforts to also help people stay away is we're opening a respiratory center in Hiawatha on Boyson Road. That will be something that patients will be referred to for concerns regarding COVID so that they can be evaluated or tested. The way that will work is you'll call your doctor or one of the triage lines and be referred there. The second thing is ongoing with video visits, trying to make it so that patients don't have to see the doctor. This is increasing rapidly. And so call your doctor's office, and if you feel like you need to be seen, see if there's an option to do a video visit so that we can keep you at home. Thank you. Oh, I'm supposed to introduce Dr. Arnold. There he is.
Thank you, Dr. Meyer. I'm Dustin Arnold, Chief Medical Officer at St. Luke's Hospital in Cedar Rapids. Just to complement and collaborate with Mercy, my colleagues at Mercy, Union Point Health also has a respiratory clinic for respiratory illnesses, and it's our West Side Urgent Care. So with collaboration, we have one on the northeast side of town and then one on the southwest side of town. I want to go back to that analogy I used the other day of the 3 buckets. So we have 3 buckets. We have the susceptible population, which is all of us because we've never had this. It's a novel virus. We have the infected or infectious, and we have the recovered, which is a very small number. For every infectious person that comes in contact with the susceptible, 4 people get sick, and then that person gets 4 more people sick. And what we're trying to do by having the equivalent of a shelter in place and being so disciplined with that is we're trying to prevent infectious or infected people from having contact with the susceptible. Influenza is about a little over 1. So for every case of flu, you have a little over 1 case of influenza. This is 4 times that. And of those 4 that might get sick, if there's somebody's grandparents or a loved one that's susceptible to a chronic infection or immunocompromised state, their chances of dying are significantly higher than influenza, probably about 10 times higher. And Dr. Meyer's right. We have made preparations at the hospital, unprecedented preparations, beyond the flood, beyond Ebola, and we are preparing. But if this happens too quickly, not only will we have too many people entering the infectious bucket, but we'll also have staff getting in the infectious bucket. And that those two, the staff and capabilities, are the only thing we have to fight this because it is supportive care. We don't have medications for it. So as a reminder, stay home, stay in, social distance, 6 feet, 10 minutes or less, and somebody's grandparents will make it through this. Thank you.
I'm Brad Hard, the mayor of Cedar Rapids. This is incredibly important information for all of us to hear. It's still not time to panic, but it is time for every one of us to take the recommendations, take those precautions. We will get through this if everyone does their part. I think it's important, as the doctors have indicated, the actions each of us take today may help save or take lives. So do the right thing. We will get through this. And now we're going to open this up for questions, and as in the past, if you would direct your questions directly to one of the speakers, that would be helpful.
I have a couple of questions. I think they're probably for Unity Point. I had a couple of questions about the mask donations. Do you know at all, I know that you guys put out a call about 6 days ago for sellers. Do you know at about how many donations you got so far and if you need more?
The question was the mass donations, following the recipe, if you will, or pattern to make as outlined on the unit. It's been in the thousands. I want to say around 5, but that might be an underestimate. And we're always willing to take more because we do see these as complementary to helping social distance and preventing the spread of the contagion.
And then I just have one or two more questions. I was talking with someone who was helping make them, and I just wanted some healthcare input. So the pocket is kind of a new part with the Olsen mask. Can you tell me a little bit about the pocket and the filtration that can go inside of it and how that makes it more effective?
Well, the mask itself is fabric. I'm not a seamstress, so if I get this wrong, I call a pass on that. But then the filter that goes in there as directed goes down to the microns that are acceptable to prevent the transmission of the contagion.
I think that's great. Yeah, thank you.
I have questions for both the hospitals, so either one of you or both. First, with ventilators, I know that's been a huge concern across the country is the capacity of ventilators and how many there are. Yesterday, Governor Reynolds said that right now there are 280 ventilators available for use in the state. How many do we have right now in Linn County, and are we doing anything to try to procure more?
The question was about in ventilator capacity. I think in Linn County right now we have well over 100 between the two hospitals. I think that's a fair assumption. Unity Point Health has requested more ventilators, I believe 20. But it doesn't matter how many ventilators you have. If these patients all present at the same time, think of all the car wrecks that happen in the world, or happen in the United States each year. What if they all happen on the same Tuesday? That would just overwhelm the healthcare system. So think of it that perspective, that no matter how many ventilators we had, if this illness all presents at the same time, it would simply overwhelm the healthcare system. And that's why we want to social isolate and slow down that spread with the contagion.
Going off that then, I was reading some reports that show, or seem to indicate that an even greater need is the lack of ventilator therapists across the country. At this point, same thing, do you know how many there are in Linn County, and are the hospitals doing anything to train other staff members to have this ability?
Both hospitals have an adequate supply of respiratory therapists, and in addition, they cross-train critical care nursing to take that ventilator duty as well. So I feel providing that the contagion is slowed down and doesn't affect the staff so they can come to work, we have plenty of staff to take care of these patients.
Okay, I have one more question for you since you're up there, Dr. Arnold. And yeah, you can answer this one. At this point, have any hospital staff members at either hospital tested positive for COVID-19? And going off that, what is the protocol if a hospital worker does test positive?
Well, we couldn't share that with you from a patient privacy standpoint, even if it had occurred. If a healthcare worker would screen positive and have symptoms, they'd be pulled from exposure to patient duty, tested for COVID-19, sent home to self-isolate, and then they would be at home at least for a minimum of 7 days per Iowa Department of Public Health recommendations, and then they would also have to have 72 hours free of symptoms without an antipyretic, as Heather indicated, prior to returning, and then they'd have to mask with patient care duties upon return.
So they're following the same protocol that the IDPH
Yes.
has set?
The IDPH has sent that out in the governor for essential healthcare workers. That's how that'd be.
Some hospitals have been like temperature checking nurses. I don't know if you addressed this in maybe previous conference, I'm not sure if you did, but is that anything that's been in these counties?
Both hospitals are, the question is screening nurses and staff. Both hospitals are screening employees, physicians prior to entering the hospital or at the time of entering the hospital, and both hospitals restricted visitors.
I just have one other question for public health. So I know a lot of people have been really looking for the fever and the cough specifically as an indicator that they might telltale sign? Is there anything else that people should be looking for or thinking about?
Thank you. So the question is, we talk a lot about fever and cough as being an indicator for COVID-19. Those are still the primary symptoms that we see with COVID-19. So anyone with a cough or a fever, we are going to be suspicious of COVID-19. However, and this is what we want to emphasize, no matter how mild your symptoms may be, even if there is no cough, even if there is no fever, if you feel sick, stay home. It's not worth the chance of exposing somebody else to what could potentially be COVID-19. So if you feel sick, stay home. Doesn't necessarily mean that you need to go to a healthcare facility. Again, we do not want to overwhelm our healthcare facilities with patients that have mild illness. If you can stay home and take care of yourself, then please stay home and follow those guidelines of being fever-free for a full 72 hours without the aid of medications, symptom improvement, and 7 days from the onset of your illness. If we can all do that, if we can all practice that, we can help to slow down the spread. Thank you.
Heather, I have a question that you might be able to answer since you're
Yeah.
up there. About the request for the donations of PPE, just kind of hoping for an update on that. Has any of that been distributed yet? And then the second part is, I know we were talking about a lot of going to the hospitals. Are home health care workers eligible to receive these donations? And if so, how can they go about doing it?
Yes, we do. The Linn County Public Health is working with EMA on acquiring additional PPE supplies. They are sending out surveys each week to agencies to see what their needs are, and then helping to address those needs as issues arise.
So are the home health care workers, are they?
Home health they can also fill out that survey too. If there's a home health care agency or another agency, residential treatment facilities, different places that have individuals that are being taken care of, and if they are not part of that listserv already, if they're not getting those surveys and they're within Linn County, then they can go ahead and contact Linn County Public Health. We'll get them on that distribution list. Thank you.
I do have a few questions from offsite. The first question comes from Grace King. It says, the state of Wisconsin has modeling that shows between 400 and 1,500 deaths there from COVID-19. Have you seen similar modeling for Iowa? And what does it predict? With what you're seeing in Linn County, do you have projections about how many cases and when that peak could come here? I think I'll let Heather answer this one. Or, sure.
Sure, go for it.
The question was, what has the modeling shown as far as the degree of deaths that we'll have, as well as when it'll peak? That simply depends on whether or not we self-isolate and follow the guidelines that everybody's mentioned here today, and not let the infectious people have contact with the susceptible people. That'll change everything. If you figure a 70% incidence and a 1% mortality, probably less than 1%, you can do the math there based upon the population where we'd end up. But again, if we can socially distance, if we can have this self-imposed shelter in place, we will be able to slow that down. When it peaks, hard to say. Anywhere from April 15th to the end of May. That's just too hard to say at this time.
I have another question for Grace for the hospitals. It says, how many patients are in the hospital and have the number of beds in their facilities increased? Would hospitals support local shelter-in-place orders?
Yeah, of course. I'll take that one. Go up and answer this. So let's see, I'll go in reverse. So shelter in place at this point, I assume that people have already heard what the governor said. The governor recently shut down most retail and non-essential businesses, which essentially is about all you would get from a shelter in place. So I think essentially that was the right thing to do. And so that's the shelter in place. The second one was about One of them was the numbers in the hospital, and really, I would defer to public health to monitor that and report if needed. We do have patients in the hospital, but I'm not going to get into specific numbers. And the number of beds in the hospital, we're continually looking at that. Again, like Dr. Arnold said, we've massively increased our intensive care capability. But one of the things, it's a correct question. It's not just the intensive care that could become overwhelmed, but the entire hospital could, with people being there if it comes in too fast. And so we are also just opening up other beds that were used or preparing rooms that have been used for offices in the past. Dr. Arnold has said this several times, and so have I. Space is an issue, but staff will get to be more of a critical issue, especially if we have staff become ill. It won't be so much about the rooms availability, it'll be about whether we have staff to take care of patients in those rooms.
So some of these questions may be a bit repetitive, but to honor the people that are asking them, I am going to ask them again. This question is from Brian Morelli at the Gazette. In Johnson County, hospital leaders advised against shelter in place or shelter at home, citing disruptions to the supply chain, economy, and increase in sense of panic. People may not leave home if they need help. Can the hospital officials comment on whether or not they recommend this action? I believe you answered that question, so I will wait for Brian to respond. Sure.
That is kind of misquoting what the Johnson County officials said. You know, they said the same thing, self-isolate and distance, but they did go on to note that, you know, the population in New York is 28,000 people per square mile. We're about 300 in Linn County, and that shelter in place would be disruptive, but they were basing it upon the differences between other places, and they weren't saying flat out that they refused to do that this time, but they were willing to look at a metric that would adjust that. So I think in fairness that was their response.
And a second question from Brian, and this is for our supervisors and cities. His question is, Governor Reynolds, just at her afternoon news conference, stated that local authorities don't have the authority to order shelter at home. She does have the authority to order shelter at home orders on a localized basis. Can the officials from the supervisors and the cities comment on how they respond to that ruling?
Well, the ruling isn't really surprising. It's what we were afraid the answer was. I think the governor the day before said that the counties and cities could do it, but we asked for clarification of that comment in the last 2 days, and the clarification came today in a press conference saying we don't have that authority. We will continue to take steps to urge the governor to do the right things and take the right steps. If the actions that she declared today don't have a significant impact in slowing the spread of the virus, we'll be asking her to do more and more.
Good afternoon. I would echo the sentiment of Mayor Hart. Look, you know, the past several days, Linn County has been researching what a shelter-in-place might look like because we were under the idea, according to the governor, up until recently, that this was within the authority of local governments to do. And as you heard from our medical community, we need to be doing much more social distancing to slow the potential impacts to our hospital system here. And of course, one of the ways you could accomplish that would be through a shelter-in-place order, which again, we were looking at up until we heard from the governor who has changed her position. But as the mayor has said, we will continue to do everything we can do here to encourage businesses to help us mitigate this, whatever changes or practices they could implement. We are going to continue to encourage our residents to do the right thing and look for innovative ways to limit the amount of time they spend outside. With the understanding that the sooner we are able to start to flatten the curve, the sooner we can get through this. So we'll have a lot of temporary pain up front, but through shared sacrifice, we will be able to have a significant impact and come out of this together in pretty good shape. But we got to do the right thing now, and we've got to do more of the social distancing right now to get to that outcome. Thank you.
That will conclude our press conference for today. The next press conference is scheduled for Monday. As a reminder, we are moving to a Monday, Thursday schedule for press conferences. Thank you.